All right, I'm rolling.
Hi, my name is Rabizadeh, and my project is on neurogeneral anomalies. In what category? I'm in the health category. So an inborn neurogeneral anomaly is any malformation or dysfunction that happens while the child is in the womb of the mother, involving any of the renal or reproductive organs, so like the kidneys, the bladder, ovaries, uterus, anything like that. A majority of times, especially now, there is immediate treatment that exists for malformations, so things like surgeries or medication or antibiotics. But too often, the side effects follow the patients through adulthood, especially when they move on to wanting to have kids or just the function of their day-to-day life. So I guess my goal, I would hope that there are ways to combine treatments that are both very effective for the patient but also less invasive, so that when they move on into further life, they don't have some of the same difficulties. And maybe if a lot of the data that we've seen with the different treatments for patients with urogenital malformations can all be compared in one big study, then it'll be easier for us to understand what is more useful, what is less invasive. My textbook question: are there certain treatments which are less invasive and generate less difficulties later in life? If so, are these treatments as effective as invasive surgeries or medicinal treatments? So if you do a laparoscopic surgery, for example, which means you make a tiny cut and go into the throat, is that as effective as opening the patient in a typical, 6-hour surgery? My hypotheses: if there are more treatment plans consisting of treatments that are most effective and least invasive, then patients will have a better quality of life and face fewer repercussions both immediately and later in life. So my rationale, kind of ties back to myself, because I was born with bladder exstrophy, which is a urogenital anomaly, and then because of the repair they did, now I have problems with my muscles and all of the above, which could have been fixed at birth, and now when I'm 16, it's pretty much too late. There's not much you can do. It's a lot easier when it's a little baby, because they're a lot more malleable, I guess. My materials, lots of data, because it's a data mining project. Obviously, being 16 and being a student, I can't go operate on patients and just see what works best. So I have to entrust other doctors in the way they've gone about treating their patients. My procedure: first I'll work with a pediatric urologist to see how, so I'll choose 5 anomalies and see how those 5 are treated immediately, and then I'll repeat step 1, so I'll talk to 2 pediatric urologists, just so I have more than one opinion, because sometimes doctors sway toward one type of treatment, they prefer something over the other, so it's good to have more than one opinion. Then I'll work with an adult urogynecologist to see how their patients were treated as children and kind of where they are now. And then again, I'll repeat step 3 to see a wider range of patients and their treatments and the results. Then I'll gather the most common repercussions patients are facing later in life and see what they were initially treated with, and compare all the prior treatments to each other. Once I pinpointed the treatments that seemed the most invasive and least effective, so they give the most trouble later on, I'll make courses of treatment that would seem most fitting to the goal of less invasive, very effective. Last, I'll put all my research into a project to present at science fair. My variables: I can't really explain my project in terms of variables because they're kind of are not, but I'm looking for the effective and non-invasive treatments for urogenital malfunctions in females, so I guess that's my independent variable. I don't know how to put this in this term. Safety concerns. Okay, so the concern with projects containing data, especially patients, is privacy. So I just have to make sure that I don't put the patient's name anywhere, and I won't, but I guess that's the only thing with safety I can come up with, is to keep everybody's medical records and whatnot private and safe. Also, if I'm able to shadow a doctor in surgery or work in a lab, I have to be sure to take, to scrub in, take all the necessary safety precautions for myself and the patient and or lab materials.